Welcome to this Oncology Data Advisor interview. This week, we have a special series in store for Women's Health Week, and we'll be posting a video every day featuring a different topic in women's health. Our first one of the week is with our editorial board member, Dr. Jasmin Hundal, who is a Hematology Oncology Fellow at the Cleveland Clinic, and she's here today to discuss the topic of heart health. Jasmin, thanks so much for coming on today.
Thank you for inviting me today. Look forward to our discussion.
Absolutely. So to start off, would you like to give us some background about heart disease in women and why it's so important to talk about heart health?
Yes, absolutely. As we know, heart disease is the leading cause of death for women in the United States. Yet for years, it's been under-recognized and under-researched in women compared to men. And women actually often present with different symptoms, maybe less likely to receive also aggressive treatment because of that. And sometimes they themselves don't perceive them at risk. So it's important to talk about heart health in women, not just during crisis, but also during routine part of our preventive care. And I think raising awareness is the most important thing that we can do.
Absolutely. Speaking about preventive care, what are some of the signs and symptoms of heart disease that women should look out for, and the signs and symptoms that clinicians should counsel their patients to look out for?
That's a great question because symptoms can be subtle and atypical in women, while chest pain and radiating to the left arm is the most common symptoms that we're taught. But in women, it can also present with other symptoms such as fatigue, increased shortness of breath, especially if it's shortness of breath or exertion and at rest, sometimes nausea, jaw pain or back pain, neck pain, or even heart palpitations, which can represent as anxiety-like symptoms. So I think these are something that one should definitely take into consideration. And these can easily be mistaken for other conditions such as acid reflux or indigestion or even stress. But the key is to not dismiss them if they're definitely new and out of the ordinary and increased in nature. They definitely should seek immediate medical attention.
That's great to know. Are there any ways that women can reduce their risk and prioritize their heart health?
Yeah, definitely. I think being protecting your heart health also protects you from other cardiometabolic diseases, which I'm a big advocate for. So definitely one of the key things is to simple is just to look at your current lifestyle. So definitely incorporating regular physical activity, like aerobic as well as strength exercises, because those have been shown having positive impact of overall disease outcomes. As well as prioritizing whole food rich diet, decreasing the processed amount of food, reading at the labels. If you a good trick that I teach my patients is if you're unable to recognize the ingredient or it's not in your cabinet or in your fridge, then think twice before buying or eating that food, because that's definitely a sign of a food quality is low. The other thing is saturated fats, to limit that. In addition, looking at substances, limiting the alcohol intake or not even drinking alcohol, thinking about alternatives, not smoking, managing your stress is really important, and as well as good quality of sleep are definitely foundational, because if you're in this chronic low inflammatory state, that just leads to other, it's like a waterfall. And overall, women should stay on top of their health checks. Sometimes we prioritize our career, family, and things can get in the way. So definitely schedule your annual preventive visits, like your OBGYN visit. And I feel key is just advocating for yourself.
Really important things to keep in mind and try to incorporate. So moving over a little bit to the oncology side of things, I'd like to tell us more about the field of cardio-oncology and what the intersections are between heart health and cancer.
Yeah, for sure. Cardiology is a very fascinating and evolving field that focuses on preventing, treating, as well as managing your heart conditions while patients undergo treatment, but even post-treatment. Many effective cancer therapies, including targeted therapies, for example, if you think about breast cancer, there are HER2 targeted therapies, but there are also chemotherapies that do affect the heart, as well as radiation and newer immunotherapies also do cause inflammation of the heart. So these are all risk factors. So usually as a plan of care, when we see patients in our practice, if we do know that this has a cardiovascular effect, then we usually do get echocardiograms because at the beginning of the treatment, during, and as well as the end, depending on the treatment plan. But overall, it's also important, especially if you're on aromatase inhibitors, for example, in breast cancer, that does lead to increased risk of cardiovascular disease. So it might not be that you're actively enrolled in a cardio-oncology program, but it's good to have a discussion with your oncologist about what you can do to, prevent from any cardiac disease from happening.
Absolutely. Thanks for the overview. So, what should oncologists know about addressing heart health for their patients undergoing cancer treatment? How should they counsel them?
Yeah, so it's really important because as oncologists, we think like the primary care physicians usually take care, look at it. They do, and but as oncologists, we are definitely sometimes seeing the patients during their cancer treatment more than they will be seeing their primary care physician. So I think it's really important to just keep an eye, just make sure that they have a read that are up to date with their cardiac workup, like a lipid panel, A1C, like how look at their cardiometabolic disease, see if there's anything that they can do in their current realm, whether it be lifestyle, whether it be medication wise, how you can optimize their cardiometabolic health, because the cardiometabolic health definitely plays a significant role in how they will be performing while they're undergoing treatment or even after treatment. So it's really important that to pay attention at that point as well. And if it gets busy, and also thinking about like if cardio-oncology plays a role in this patient's case.
Absolutely. Great to know. I know this applies also to cancer survivors who have finished treatment. How should survivors be monitored for cardiovascular risk?
Yeah, definitely. So like as I said like earlier, like there are some chemotherapies, targeted immunotherapies that we do know that have an elevated, and radiation that have an elevated risk of like cardiac disease. So usually these patients are, monitored, like do have cardiovascular monitoring throughout. But nonetheless, being just in general, like a human, like even with or without cancer, it's important to have a regular workup, including, your regular blood work, but like in certain patients, especially in cancer patients, further imaging might be needed at a regular basis, such as like echocardiograms.
Great to know. So as we wrap up today, any take-home messages you'd like to share in honor of Women's Health Week and the importance of a women prioritizing heart health?
Yeah, definitely. I think your health is definitely worth prioritizing. Women are definitely, as I had also mentioned earlier, like our caregivers, and we tend to be multitaskers, and we tend to sometimes like neglect things, and we'll get back to it. So definitely like listen to your body, and like if something is wrong and something is not the usual, definitely seek medical attention. Talk to your primary care physician. It's definitely important to advocate yourself in the medical settings. Like, if you just, even if you think it might not matter, just say it. Like, we are here to listen and be there for you. And last but not least, like adding a healthy lifestyle, I think will keep you as well as your other family members and friends, healthy.
Amazing. It's such an important topic to spotlight for Women's Health Week. So thanks so much, Jasmine, for coming on today to tell us all about this work.
Yeah, thank you for having me.